It is important to note, stability does not equal rigidity. A joint can never be too mobile. Active rotational movements at the outer limits of articular motion are essential to ensure neurological control safely. We want to provide the central nervous system with as much afferent feedback as possible. We will prepare the system for more complex tasks. The more specific we can make the basic motor program, the easier it will be for the central nervous system to control more complicated movements. The capsule contains an abundant amount of mechanoreceptors. They make up the innermost tissue across the joint and are the first to perceive this motion. Unlike muscles, they can provide complex multidirectional and rotational information, along with linear motion too. Stress these active rotational movements at the outer limits of articular motion to provide as much afferent feedback as possible. This will improve neural training. So why is being active so important? Static stabilizers are able to provide afferent input in multiple angles and at different ranges. We can tune the articular capsule at different angles and obtain the maximum amount of afferent feedback to the central nervous system. This ensures constant feedback. Muscles will control the tone of the capsule and keep it primarily engaged. All range of motions at its outermost limits in a controlled manner, looking to expand the circle, helps with joint stability. There is positive tissue adaptation from stretching the capsule, the ligaments, and the tendons, which adds to more stability. Mobility and stability are synonymous, having control of the motion through the range of motion, which is different than that of rigidity. Important to note, active mobility is how much range of motion does one have with active range of motion with good control throughout that range of motion. Passive mobility is how much range of motion does one have with passive support in reference to glides, rocks, and rolls within the articular capsule within the joint. This is wasted range of motion if it's not able to be controlled well. Active rotational movements at the outermost limits of articular motion helps restore kinesthetic awareness, neuromuscular reprogramming, and improves passive articular strength and stability. It can also help with joint health and longevity. This will help remodel scar tissue and fibrotic tissue. Also will assist with tissue sliding and gliding motion. The plan always is to first expand the motion, second control the motion, and third create new powerful motions. We must always try to engage the mechanoreceptors and keep them active as frequently as possible. With active rotational movements at the outer limits of articular motion, there's a continuum, or a hierarchy if you will. Level 1 is more movement focused, looking for passive range, helping with assisting inflammation. Level 2 is more of an articular focus. You can use this more with a morning routine or also with early rehab. Moving into warm-up and potentially some late rehab. Level 3 is more capacity focused. It's higher on the central nervous system radar with irradiation and used primarily for training techniques. While trying to integrate and teach this system, it's okay to teach the patient with a choppy motion first. As they become better with the motion, they can integrate them into more whole movement patterns, more of a global rotation. With level 1, we want to allow the patients to fail with many reps, then teach them one thing at a time. This helps with motor learning and motor control. Allows to give them simple feedback. Always used during a warm-up, a rehab, or a daily routine. Be patient and let them figure it out. Minimal to zero irradiation will occur here. With level 2, we're starting to do legit joint training. Starting to carve out a joint. Do it as well as they can. Tactile feedback, verbal cueing, passive blocking. You want them to feel somewhat defeated. Don't jump ahead in levels if they're not ready. With level 3, we will perform irradiation as hard as they can. Max effort with internal load. They must have a joint that moves exceptionally well in order to start this progression. Before these though, we must identify first, using it as an assessment tool. We're always looking at rotational patterns versus linear patterns. There are rules to these though. We look at rotational patterns first, learning how to assess the end range articular motions. This in essence acts as like a Swiss Army knife. There are many ways to use these. This can be done passively by the physical therapist, but generally are used with active range of motion first by the patient. We attack rotational deficits first. An example we can use is shoulder rotation as it affects overhead flexion. We use this before we look at any type of linear deficiencies. This all comes into effect except for the spine. The spine, we always check linear patterns first. The capsular function of the spine is flexion. We'd want to spend more time doing our agonist and antagonist contractions in this position to increase the range of motion. Without linear function, it would be tough to side bend and rotate very well with the spine. The spine should be moved into flexion. Loaded flexion does have a greater penalty though. Areas that do move well will want to accept that load. Areas that do not move well will usually not want to accept that load. Assessing the movement pattern is safe as long as it's unloaded. Moving blocks are areas that don't move. Hinge points are areas of the spine that do move. In order to assess this, we can place somebody in a quadruped position looking at a cat-camel motion. So in summary, what are the main reasons why we're using this system? 1. Range of motion maintenance. Number 2. Articular health and longevity of your joints. Number 3. An articular screening process. You can use this to look at poor motion patterns during the expected full ranges. It's important to carve out your program design around the limitations you might find throughout your screening process. And number 4, for rehabilitation purposes. Simply stated, if you don't use it, more than likely you'll probably lose it. The brain will not want to do anything that requires extra energy. It acts as a conservation system. Think of moving your joints in an articular motion at end ranges similar to brushing your teeth on a daily basis. It'd be wise to create a morning routine to maintain your range of motion and stimulate those mechanoreceptors. This system will help with reorganization of cells, helps with realigning normal striated tissues, and helps pump out inflammation, bringing healthy fluids into the joint.